Hello everybody, I am Dr. Lohitha Krishna, breast oncologist and oncoplastic breast surgeon at Sri Shankara Cancer Hospital. Today I am going to discuss about a very important topic, that is breast cancer. According to the 2020 statistics worldwide, breast cancer is the most common malignancy not only in India but also globally. It is very important to know about the signs, symptoms and what we can do to prevent this breast cancer and its early diagnosis. 1 in 29 women are at a risk of developing breast cancer in their lifetime. The risk factors are divided into two. One is modifiable risk factors, the other is non-modifiable risk factors. Non-modifiable risk factors are gender. Female gender is at an increased risk of developing breast cancer compared to the male gender. It is not that men do not get breast cancer. Men also can have a chance of getting breast cancer, but women are at a higher risk. Next is your age. As the age increases, the risk of developing breast cancer also increases. Breast cancer initially was most commonly diagnosed in postmenopausal age group, but it is not so now. We are seeing a very increased number of breast cancer cases in women under the age of 40 years also. Compared to the West, in our part of the world, we see breast cancer a decade earlier. That is the reason why awareness is so important. Women should be aware of how it presents and what to do about it. 5 to 10% of breast cancers are hereditary. So genetics is also something that we cannot change. So female sex, increasing age and genetics are non-modifiable risk factors. The other modifiable risk factors are having a child after the age of 30 and not breastfeeding the child increases the risk of breast cancer. Nulliparous women are at an increased risk of breast cancer. Multiparity, increased breastfeeding, multiple pregnancies, these are protective against breast cancer. Your lifestyle modifications, smoking, alcohol consumption should be limited. All these have to be done. Increased physical activity, minimum of 45 minutes, 4 times a week is necessary. Coming to what are the signs and symptoms of breast cancer. The most common symptom with which women present is a painless lump. So a lump in the breast is the most common sign which is noticed, but it is painless. Women think they developed a lump, maybe nothing, it is going to go by itself, but no. That has to be examined and checked. That is one thing. Next thing is any amount of skin retraction or nipple retraction that you observe, any bloody nipple discharge, any thickening or redness of the skin. These are some changes which if you notice has to be examined by a doctor. These are the most common ones. Sometimes you may find some lumps even in your armpit also. So that also has to be checked. So how do we screen breast cancer patients? Screening techniques, what you have, mammography. Mammography is the most commonly used and a very accurate diagnostic tool to screen for breast cancer. It is not a very painful procedure. You stand and your breast is compressed between 2 plates and an X-ray film is taken and checked to find any lesions are there. This detects lesions very early, even before you are able to palpate it. That is very important. The other diagnostic modality is ultrasound of the breast, MRI of the breast. These also can be done to identify the lumps. But every woman after the age of 40 is advised to get a mammogram done. Now, once suppose you do a mammogram and you've seen a suspicious lump, the next step to do is to do a core needle biopsy. So a needle is inserted into the lump which is there and a small piece of tissue is taken and examined under the microscope. After a clinical examination, mammogram finding and a core needle biopsy, that we come to a conclusion about what is it? Is it malignancy? The diagnosis is made based on this triple assessment. So these 3 things and then we will come to a diagnosis. Now, this is very important before we break the news to the patient. What are the treatment options available? Mainly, cancer therapy includes a surgical procedure, chemotherapy, and radiation therapy. Unlike in the past, surgical procedures are now very much advanced. Before, even if a small lump was seen, surgery used to be very radical. The whole breast along with lymph nodes in the armpit used to be removed, leading to a lot of morbidities. But that is not the case now. We do not have to do a total mastectomy, that is the total removal of the breast. We can only remove a part, the lump which is there, and give radiation therapy, which gives equal results as that of removal of the entire breast. Now doing less is considered as more. When we remove all the lymph nodes in the armpit, there is a risk of developing arm swelling. That is also minimized now with very good surgical procedures, that is a sentinel lymph node biopsy. Now that is also a very standard of care when nodes are negative. We do that procedure and take out only few glands in the armpit. Next thing, this surgery is followed by some amount of systemic therapy. So systemic therapy is chemotherapy. So majority of the patients will require chemotherapy in few postmenopausal women when the tumor biology is good. So what do I mean by tumor biology? In this breast cancer also you have 2-3 different types based on your hormone receptors which are present on the tumor. Hormone positive, hormone negative, HER2 positive tumors. Based on that, our further treatment plan is decided. So in tumors with favorable biology, postmenopausal women which are diagnosed very early, around 2 to 3 centimeters, there is a slight chance that we can get away with chemotherapy. That is a risk assessment test which can be done and then it can be determined. But majority of them would require a chemotherapy. This chemotherapy is nothing. It is nothing but chemotherapeutic medication given over a period of 4 to 5 hours in a 500 ml bottle of saline. Of course, it has few side effects. The hair loss is something which is very worrisome for most of the women. But what we would like to tell is, yes, they lose hair only during the time of chemotherapy, and it is going to come back after the therapy is stopped. So that is something with, if it is necessary, your doctor will advise, and if you take it, it is going to definitely benefit you. The other thing is a radiation therapy technique which will be used externally. Radiation is given to avoid local recurrence in that part of your breast. The other thing, all these are combined with some genetical evaluation. When we see the patient, we ask if there is any family history of malignancy in the first degree relative or the second degree relative. If there is anything like that, or the patient is very young, less than 40 years of age, and she had a malignancy detected, genetic testing is done. BRCA genes, that is the BRCA1 and BRCA2, are the most common genes, genetic mutations that are detected when these women are tested. The plan is then sorted out accordingly. Very important is to undergo a pre-test counseling and a post-test counseling. It really helps in going through the whole process. So what can we do from our end to prevent this breast cancer? One thing is self-breast examination. Self-breast examination is a very easily performed procedure in women of all age groups. So 5 days in premenopausal women, 5 days after your menstrual cycle is over is the right time to examine your breast. It is non-tender. You can take 3 to 4 fingers of your palm and in circular motion try to examine your breast from 12 o'clock to again 3 o'clock, 6 o'clock, 9 o'clock, and back again to 12 o'clock position. The whole area from the clavicle to the armpit is examined, and you can check if do you find any lumps or anything. So in the shower, while lying down on the bed, it can be examined. For postmenopausal women, this examination is done. Maybe you can remember a date when you can do it: first of every month or last of every month, mid of every month. Keep one particular day in your calendar and do the self-breast examination. Only when you keep doing the self-breast examination every month, you will know how your normal normal breast look like. So when an abnormality arises, you will be able to catch it much easily. You should never examine your breast between your thumbs like this. Everything will look like a lump. That is actually a breast tissue which you're feeling. So it should be examined in a circular motion. That is one thing which can be done. Physical activity, alcohol consumption should be avoided, especially in urban populations. Physical activity 4 to 45 minutes, cardiac, walking 4 times a week for around 45 minutes is what is advised to keep yourself healthy. Avoid gaining of weight also. If you're taking any hormone replacement therapy, that is another very important risk factor which is to be avoided for a longer time. Postmenopausal symptoms, when any woman is having, we advise them to go through some alternate yoga or meditation, something like that, to get your postmenopausal symptoms under control, than relying on the hormone replacement therapy. So this, and after 40 years, every woman doing a mammography is going to benefit you a lot. A lesion, very small, it can be detected, and you can get away with all the harsh cancerous treatments also. It is only when the lump or this malignant lesion is diagnosed early that the patient is going to have very excellent results, than coming to us very late. So this is something that you can do at our end. There is a number available. If you have any doubts, you can call and contact us and get back to us. Thank you so much.